ado, let's go ahead and talk about the upper extremity. So really we're talking about the upper body from effectively all the way at our clavicle and our wonderful manubrium all the way out to the hand. So the first joint we have is the sternoclavicular joint, okay? It is going to be where we have a ligament that's going to keep our effective clavicle sitting inside of its little joint with our manubrium, and this is where we're going to have a modified ball and socket. So we're not really getting a lot of internal and external rotation. You can get that a little bit through scapular function, but obviously we can talk about protraction, retraction, elevation, and depression. So we're going to have that moving around accordingly. Now, obviously, one of the biggest things when it comes to function of the shoulder that a lot of people can overlook is going to be the scapula. Now, there's muscle mass that's going to allow it to move in a lot of different directions that are going to allow us to stabilize our shoulder and put ourselves in a better position to express force. Now, I'm sure a lot of you guys have heard of the AC joint, aka the acromioclavicular joint, where our acromion process and our clavicle are going to come together. This is going to be, held in place by two separate ligaments that are going to keep it in position. Those of you guys that played sports like football and otherwise, any of you guys ever separated your AC joint or had an AC joint sprain? None of you guys ever had that from tackling somebody or otherwise? That is something that happens quite frequently in tackling sports, because when you lead with that amount of force, you can effectively separate those two, and it's going to be super painful, obviously, and make it really hard to use your arm for a couple days. Now, we also have what's known as the coracoclavicular joint. Okay, and that's where we've got a little bit further up, we've got that coracoclavicular ligament, which is going to keep the scapula and the inferior part of the clavicle close together. So same thing, it's just helping stabilize so that our clavicle and our scapula are effectively moving together as one. Now, we then get to the actual glenohumeral joint, and that's going to be our actual humerus and then the glenoid fossa that it happens to be sitting inside. Now notice we've got a lot of different ligaments that are keeping it linked in, along with we've got our long head of our biceps and a couple other muscles like the long head of our triceps that are crossing over this from our arm, along with then we're going to have things like our lats, pecs, deltoids that are going and attaching into the humerus. Now, what happens to be inside of that glenoid fossa? That's going to be where our humerus is rotating through. What's going to be inside of there? Throwing athletes can tear it. What's on the glenoid side that's inside of all of those wonderful ligaments? Labrum, exactly, Raquan. So labrum, unfortunately, is what gives us more surface area, so that's going to make it a bit better for dealing with forces. However, like anything else, it can be overstressed. If it tears, you're going to have shoulder instability, and you're going to have a lot more issues with not just function, but pain that's going to be associated. So like for myself, I tore the right labrum in my shoulder when I was cheering at Kansas, and it just bothered me for years until my shoulder slightly subluxed when I was doing heavy dips, and that's what tore my pec. So it's a lot of fun whenever it pops off. Now, the nice thing is, since the glenoid fossa happens to be so shallow, especially when you compare it to the other major ball and socket joint, which is your hip, which is we can have naturally a really large range of motion. The problem is it's relatively easy to dislocate it. Now, we then have what's known as the scapulothoracic joint, which is going to be the articulation between the front of your scapula, so the front side of the scapula, and then your thoracic wall. Is there any bony attachment between the two? Is there any bony attachment between the two? Yeah, there isn't, Luke. It's only going to be muscle. That's actually what's stabilizing our scapula. So our clavicle is actually attached to our rib cage and then obviously attaching to our scapula. But on the back side, it's literally just muscle that's stabilizing the shoulder and specifically the scapula. And that's why when you talk about dysfunction, you talk about issues with shoulder issues in individuals, you need to make sure that you have enough strength and stability in those regions. Otherwise, you're going to be more likely to injure yourself. Now, the scapulothoracic joint, okay, once again, is that articulation between the two, and we have a myriad of muscles that are going to allow us to move in different positions. So, this is part of the reason why I wore a relatively plain t-shirt. Unfortunately, my wife was not kind enough to help me shave my back. So, you know, you're going to see things a little bit more than you'd like to. But if we look at my back, okay, you can see like those are my traps lifting myself up. And when I push myself down, you can see how I'm getting a little bit of activation from the lower trap fibers and otherwise that are pulling in. When I pull myself back as far as I can, you can see the rhomboids and the mid traps contracting. And then whenever I go and push myself as far forward into protraction, aka bro at the rec center position 1, I'm getting that through effectively my pec minor and my serratus anterior. But what you also get is both upward and downward rotation. So as I take my arms out and lift them up all the way overhead, you can see how the scapula are going to rotate through in those positions. And that rotation is going to be coming from a really cool force linkage between, notice how the upper traps are going to fire along with the lower traps, and then the serratus anterior. And the serratus anterior is this fan-like muscle right here on the front side of your rib cage that when they all three contract, it causes rotation. Now, in order to get depression and push those shoulders down, we're contracting the rhomboids and the levator scapulae, and then the pec minor on the front side to go ahead and get that contraction to occur, to get it to rotate the other direction. Any question about the basic 6 movements you can get through your scapula and how they're going to link together? Okay. So we have what's known as scapular humeral rhythm, meaning as my humerus moves, I'm going to get movement also through my scapula to allow for different positions to occur. Okay? They should always work together. It's when there's dysfunction, when the scapula should move, but it doesn't while the humerus is moving, that we're going to have more issues with pain and or dysfunction. So this is really obvious when you look at some folks when they're trying to get and say overhead lifting is a really obvious one. So if they're pressing a weight overhead, if they don't have the range of motion, the ability to pull back their shoulders and get that external rotation at the shoulder, you're going to see where they kind of get into the sit back position. So when I do this, I'm compensating, and now I'm going to have to round or excessively hyperextend my low back so I can get in a position where I can hold those weights overhead. So you can also have both anterior and posterior tilt. So you can kind of see I can flare my scapula forward and then reverse them and kind of rotate them backwards. So you can actually tilt your scapula forward and backwards. And that's also going to be used by variation of different muscles, which you guys can probably infer if you think about the fact that muscles only can contract and relax. Sounds simple. So if you know where the muscle's origin is and where its insertion is, all it can do is pull those two closer together. So when we're pulling those two closer together, how's it naturally going to move when that's occurring? That's all we're really looking for. Now, our scapulothoracic joint, okay, these are going to be the ones that are attaching to the scapula from the thoracic cavity in general. This is stabilizing our shoulder region, and it's going to help facilitate movement as we're going through different positions. So when you think about as in throwing a ball, so if you're coming set, you're going to pull yourself back, so you're going to be into retraction, and then maybe a little bit of upward rotation. And then as you're throwing forward, you're going to have protraction of the shoulder and possibly kind of go back to more of a neutral, not so much downward rotation, depending on position, and obviously the arm angle when you throw. Now, when it comes to the elevators of the scapula, notice, guys, it's going to be mostly coming from the upper fibers of the trapezius. But you can see how the trapezius, since it's a huge muscle, it's going to go anywhere from obviously elevating it to retracting to depressing. And then we can see the rhomboids underneath, and you can see how those are going to naturally cause rotation and potentially a little bit of upward, but mostly retraction style movement. Now, when we're looking at depression, notice we've got our lower trap fibers and we've got our pec minor, which is going to be on the front side. And that's going to be deep in underneath your pec that you're going to feel yourself pulling forward and getting yourself to rotate through. So if you ever get on like a parallel bar or otherwise, and you think about pushing yourself down, that is going to be where you're using your pec minor and that lower trap. Now, when it comes to protraction, so trying to be in a bro position 1, notice the serratus anterior, that fan-like muscle, along with our pec minor, are both going to be going ahead and pulling that scapula forward. Now, when it comes to retraction, so pulling ourselves back, that's where we're talking about both the rhomboids and those more middle fibers of our trap, but you can still get a little bit of upper and lower activation if you're really trying to retract really, really aggressively. Now, when it comes to upward rotation, remember we're going to have the upper and middle fibers of the trap along with the serratus anterior and a little bit of the lower trap fibers that are going to help a little bit with that rotation. Now, when it comes to our downward rotation, we're going to have our rhomboids and our pec minor contracting. So the rhomboids, by them contracting on the back, they're going to pull the inferior angle of the scapula up. So that's the major and minor rhomboid. Meanwhile, on the front side, we've got our pec minor here pulling downwards. So since we're pulling down here, we're pulling up here, we're going to rotate in a downward angle. Now, when we're looking at the shoulder itself, so we're not talking about the actual scapula and its movements anymore, we are going to talk about flexing. So that's going to be lifting the shoulder up in front of you. This is being done mostly by the anterior delt. So this guy right here. It's assisted by the clavicular portion of your pectoralis major, along with your coracobrachialis, which is that guy right there, along with the short head of the biceps brachii. Now, with all of those combined, you're going to go ahead and be able to get that lifting to occur. So notice, guys, here we've got that clavicular pec minor, or pec major, sorry. And then you can kind of see here where you've got the clavicular and then you've got the sternal portion of both. And then this is really showing a better example of the medial delt, as opposed to here's a better look at seeing that anterior delt on the front side, along with then we have ourselves the joys of our coracobrachialis. And then when you're thinking about the long head and the short head of the biceps, you can see how it's attaching across, and it's going to naturally, when it's contracting, lift ourselves up. Now, just because I know somebody else on our wonderful lecture has torn their pec, whenever you tore it, did you tear your entire pec off the bone, or was it just the sternal portion of the pec? And was it a tendon or was it a muscle tear? Okay, so you tore, okay. Woof. So you probably noticed a drop not just in your horizontal pressing strength, obviously, but probably your overhead pressing strength is also been suffering from that or suffered from it. Is that about right? Oof. Yeah, I only tore off my my sternal pec whenever it happened to me. How can I help you this morning?
Office and just put it
Oh, okay.
Yeah, I'll come back later because I didn't do news.
Dude, you go do your thing.
We just closed your office, so we want to.
Did you lock it?
Yeah, we'll lock it too.
Okay, thank you, Ihor. Have a good day, bud. So they had a subject lined up this morning to come in and do their testing at 9:30. The subject never showed up. So as I told them whenever I walked in the lab, don't worry, guys, when it comes to human subject research, you'll never be stood up as many times in your life as you will whenever you're actually testing people. So, you know, makes if you get stood up when you're trying to go on dates seem not so bad because it happens a lot more there. Now, when we're looking at extension at the glenohumeral joint, okay, so this is going to be going now, this was going from here to here is flexion, here to here is going to be extension. This is going to be done by the sternal pec major, our latissimus dorsi, our teres major up here, and then the long head of the triceps. Now, it's really your lats that are the freaking powerhouse in that position, okay? Now, you can see when we're looking at just the sternal pec, how we've got a lot of wide fiber angles, and that's going to be useful pulling this arm down from overhead, but you can see that lat, all this massive pennation that's going all the way into the low back and even close to the hip through the fascia is going to pull ourselves down. And then obviously to a lesser extent, we have the contributions of the teres major. Now the posterior deltoid is going to give a very small fraction of force. So the posterior deltoid is right here. That guy right there, that's the posterior deltoid. Now, when we're looking at extension, again, guys, to give you an appropriate understanding, that's how massive your lat is. So when it comes to muscular thickness, the thickest muscle on the human body should be the glute. But when it comes to like just sheer like size and real estate that it's taking up, lats should be probably at, or they're naturally one of the biggest muscles you're going to have in the human body. Okay. Now the long head of the triceps, because the triceps are made of 3 separate muscles, is going to attach into the scapula and then going into the olecranon process through the wonderful triceps tendon. So it's going to not just extend the arm, but it's going to pull the arm over. And that's why sometimes doing things like pullovers or doing overhead positions for a skull crusher can be useful as a means to really target that long head of the triceps. Now, when it comes to abductors, so this is going to be taking yourself from this position on out to the side, it's being done by the medial deltoid, middle deltoid. The supraspinatus is one of the 4 muscles of your rotator cuff, which is going to help stabilize these movements and get yourself to go ahead and lift your shoulder up so it's going to be in position, so it's going to allow itself to raise out to the side without causing pain. So you can see how you've got that supraspinatus underneath, that middle deltoid on top, and then as it contracts, it's going to go ahead and pull ourselves out to the side. Now here's the fun fact. And you guys, wherever you're at home, lift your arm out to the side with your palm facing forward, your palm facing the floor, and then your palm facing down. And you see how you naturally rotate your shoulder. So if you're doing something like a lateral raise going out to the side, you're going to effectively get, if you have your thumbs up, a little bit more anterior delt. If you've got your thumbs neutral, you're going to get a little bit more of that medial delt. And if you've got your thumbs down, you're going to get a little bit more of that posterior shoulder as you're going through. Now, when it comes to those abductors, notice guys, our supraspinatus is going to begin and active all the way through 110 degrees. That middle deltoid is going to contribute from effectively that 90 to 180. So in the other, so we're talking about the supraspinatus, or we're talking about the subscapularis, the teres minor, and the infraspinatus are going to be our other three rotator cuff muscles that are keeping us in the socket where we should be. Now, when it comes to abduction, so pulling that arm down the side, we've got sternal pec, we've got the teres major, we've got the lat, and then we've got both the short head of the biceps and the long head of the triceps. They're going to pull ourselves down. And if you want a good example of that, you can look at somebody doing like a iron cross, and you can see, hey, if they can pull that off, the crazy amount of muscular development they have, but also you can effectively see those muscles firing, that they're going to be pulling themselves into the position they're looking for. So this is, again, just imaging those adductors. Now, I've already talked about each of these, but now we're going to go ahead and get into their actual position. So when we're talking about medial rotation, okay, we are going to be looking at the subscapularis, which is a muscle obviously underneath your scapula, your teres major, okay, your pec major, anterior delt, and your lat are all going to help with that. Whereas if we're going to go ahead and rotate outwards, we're getting that from the infraspinatus and our teres minor, along with our posterior deltoid. So we naturally have a lot bigger and more powerful muscles with medial rotation and nowhere near as much with lateral rotation. And that's why it's important that we really try to develop those lateral rotators, because what do you guys, if you think about the throwing motion, which is obviously medial rotation, internal rotation, that's obviously what's creating the velocity, so that we're going to be able to throw the ball or object with enough speed that it's going to matter. However, what's the issue with, or what was the importance of your lateral rotators, aside from just giving you stability after you've thrown that ball? What do they do? So the major use of the lateral rotators after you've thrown a ball, what are they really doing? Those of you in exercise physiology, we talked about this yesterday and why it's important. That's okay, Luke. Okay, yeah, it's to prevent injury, but what are they actually doing, John? Yeah, they're stabilizing. If you tore them, you'd have lack of stability, but specifically after you've thrown that ball as hard as you can, what is your lateral rotator then doing? Think about concentric, isometric, and eccentric muscle action. Exactly. That's what's doing the braking. So it is going to be lengthening eccentrically. So your lateral rotators is what's going to be slowing down your arm after you throw that ball. So they need to be strong enough to obviously at least deal with the braking forces. So medial rotation, subscap, teres major, but then also being contributed by pecs, delts, lats, and the short head of the biceps brachii. With the major rotators, you can see that angle of how your subscapularis and your teres major are going to be sitting on the interior portion of the humerus. So whenever they fire, they're naturally going to go ahead and pull that arm in and around. So you can see how with the infraspinatus and the teres minor, you can see how they're going to be wrapped on the far side so that from the back. So when they fire, they're going to naturally rotate you out. And the posterior deltoid is going to help out a little bit. Now, when we have effectively horizontal abductors, which means literally we're going to be from here and then we're opening ourselves through. So you can see how we're getting a little bit of the lat, a little bit of teres major, but it's mostly being done by that posterior delt, a little bit from the middle delt, the teres minor, and our infraspinatus. So you can see how those posterior fibers of the delt are naturally going to pull us backwards, along with the infraspinatus and the teres minor are all going to be doing their job. Whereas when you talk about horizontal adductors, that's pec majors all day long, along with a little bit from the anterior delt, coracobrachialis, and the short heads of the bicep brachii. To give you an idea of how important those are, Raquan, after you tore your pec, did you ever try to do any dumbbell work? Like try to do some like dumbbell bench press? Okay, after the therapy. How big of a difference was there between your strong arm and your weak arm? So about 50%, yeah. Before my surgery, because I tried to see if I could just rehab it and not have to get surgery. I remember, because literally I could barely press dumbbell bench press with my right arm pretty much tucked at my side. I could press an 80-pound dumbbell for like a set of 10, and I could do the 120 with my left arm for a set of 10. So I was only at 66% at my best after all of that rehab. So you see that horizontal adduction with that pec, just the massive muscle that's really meant to pull in strong right through the center line. But it obviously has assistance from other muscle groups. Now, when it comes to the shoulder itself, you can have issues with dislocation. You can strain your rotator cuff. You can have just rotational injuries and subscapular neuropathy, so your scapulas aren't firing like they're supposed to. And because of that, it's going to put your shoulder into a weakened position. And if your shoulder is having to compensate for that lack of movement, you're going to be far more likely to injure it. Now, when we talk about rotator cuff impingement, you maybe have heard of, or shoulder impingement, that's going to often happen from people that are doing a lot of overhead work, because we're essentially, driving some of those tissues up together. And when we're talking about having both abduction and then flexion, okay, so that's going to be going out to the side and going overhead with medial rotation. So remember, rotating in through the center line. Now, we then have our happy little elbow, and that is a basic hinge joint, okay? Just our ulna, which remember is the bone towards your pinky, and then obviously our humerus. Now, we're going to have flexion at the elbow, and that's being done by the biceps brachii, which is the one you think of. Underneath it is the brachialis, and then you have your brachioradialis on the top that's also contributing to flexion at the elbow. So You can tear your biceps and you'll still be able to flex your elbow. The biceps is also going to help with supination, so turning the palm up. However, if you do tear your biceps, you're not going to feel effectively as strong as you maybe did, obviously, pre-injury, because you're not functioning on the same amount of muscle mass that you were previously. Now, the brachialis is going to be the one that you're training when you think about doing something like a neutral grip. So it's not palm up supinated. You're going to have your thumb kind of pointing to the ceiling type deal. That's going to be where some people refer to like as a hammer curl. And then as you go to more of an overhead position, that's where you can get more of that brachioradialis also to fire. Now, when it comes to extension, it's going to be the triceps. Now you're getting a little bit from the accompanies, which is really effectively helping keep you into position on the front side of the arm, but really it's going to be your triceps. That long head that's going all the way from the scapula on through, the medial head, and then the lateral head, which is going to be on the outside. Now, we then have what's known as our humeral radial joint, and this is going to be where the radius itself is going to be slightly articulating, but it's really just gliding on top. And that's going to be where we effectively have our ability to pronate and supinate our hand, because literally the bones of our form are going to twist accordingly, depending on the position that you happen to be putting yourselves in. So they naturally pivot on one another. And in the middle, we have what's known as a synemosis. So if we're looking at the movements there, we're going to have pronation. Remember, that's going to be turning the palm over, and that's going to occur from the pronator quadratus in the front of the wrist, and then the pronator teres that happens to be near the elbow. Now, for supination, we have the supinator, which is going to be right off of the elbow joint, along with the biceps itself is going to assist with supination. Now, we then have our radiocarpal joints, which we're really talking about effectively our wrist. Now, this also has what's known as the retinacula, which is going to be a band of fascia that's going around our wrist, along with it's going to protect all of the tendons, nerves, and blood vessels that are going into your hand. Your hand really doesn't have much muscle mass whatsoever. Like there's just a little bit of muscle right here for the thumb, but otherwise, you know, from a little bit of also out on the lateral side of the hand where you can get a little bit of muscle contraction, all of your movements inside of your hand are actually caused by the muscles in your forearm. It's just tendons that run the length of your hand all the way up to your fingertips effectively. That's what's causing us to go ahead and have movement. So just for fun, you can go ahead and literally just push hard on your wrist, and you'll notice that your hand naturally closes because you actually are going to pull tight those tendons to make your hand move. Now, when we're talking about flexing the wrist, well, we've got our flexor muscles. So the carpi radialis, the carpi ulnaris, the palmaris longus, and then our flexor digitorum superficialis, and then profundus. So that's the muscles that are actually attaching to our fingers. So that's going to all contribute to wrist flexion. Now, when it comes to extension, we've got our carpi radialis longus, brevis, ulnaris, and then there are a few other wrist flexor muscles. And when we're talking about our carpo-metacarpal joints, well, we've got our thumb in its wonderful saddle joint where we can get that rotation to go ahead and go through. And we can have those gliding joints of our carpals where our hands can move and have some flexibility of going and opening and closing. Now, the actual inner metacarpal joints, those are going to be the ones that we have obviously in between each of those carpals and metacarpals, sorry. And they're relatively irregular, but they're just going to essentially go across each other. Now, the metacarpal pharyngeal, now we're talking about our knuckles. And these are going to effectively just be condyloid joints that are going to be rounded at one end and then capped on the other with a finger. And they're going to end in our phalanges, aka our fingers. Interphalangeal joints, we're really just talking about our individual knuckles. So what do we have? We have flexion, extension, abduction, adduction, and circumduction, aka drawing a circle with your fingers. I always think that's kind of fun. And these are going to be done by a number of extrinsic muscles, both proximal and distal inside of our wrist. That is going to allow for all of this to occur. Now, the intrinsic are going to be a bit deeper, and these are going to go into be more distal to the wrist. Now, we just went through the entire upper extremity in what ends up being 38 minutes, and that's pretty darn quick. So, I'm glad that we were able to cover the information, but I feel like that speed there was a little insane. So, I want you guys to go ahead and let's say you are going to do actually, we're going to have you guys go into groups, and we're going to break down the muscles that are used depending on the different exercise you're doing. So group one is going to look at the barbell snatch. So you're going to tell us the movements and muscles performed in the scapula, shoulder, elbow, and wrist for each of these movements. I'm going to give each group 20 minutes to break this down. You guys are going to be randomly assigned into groups, and you guys are going to think about what is going to be the muscles and the actions that are going on. And we're only looking at, obviously, the upper body. Now, do we have any questions over the basics of what these exercises are? And, you guys can feel free to go ahead and find video versions of it, but you're going to go ahead and break us down and let us know what are the muscles what's the movement and the muscles that would be required to do that. Any questions, comments, concerns as of right now? Okay. So, depending on what group you're randomly assigned, guys, you know what you guys are going to be getting into. Do your best, and I will talk to you guys as a group and make sure you're able to paste into the chat what you guys found out in 20 minutes. Really break it down. Do your best. It's okay to make mistakes. We'll talk about it when we get there, okay? Talk to you guys in a few.